Hi class, so this is our video number 2 for tonight. We want to go ahead and finish tonight the last part of our health unit for Burlington English. So if you please want to watch the video so that we can go through the lesson. Okay, so the first thing we're going to do is you need to access Burlington English. I'm going to click on courses. Okay, when I go to courses, remember I use the purple book, the one that says Burlington Core, Low Intermediate. So I'm going to click on this video, or not this video, but on this book, and I'm going to start our in-class lesson. So our in-class lesson, we are working on number 7, life skills. I'm going to click on this, and our lesson is the following. So in this lesson, you are going to learn about prescription medicine labels. You will interpret medical information, interpret abbreviations, and role play a conversation with the pharmacist. If you have any questions, please write them down and then let me know when we come back to school in January. So for today's lesson, let's look at number 2. We have a total of 5 pictures. Here we have this man, and above him we have pharmacist. So let's pronounce this pharmacist. Okay, we have on the right side another picture. Okay, and this is a medicine label. So this label right here, the one that says RX, which means prescription, pharmacy. Okay, take 1 tablet by every day, Aldeclan, 5 milligram tab, quantity 30. Okay, on the bottom now we have pharmacy. Okay, let's pronounce that again. Pharmacy, not the same thing as pharmacist. Pharmacist is a person, pharmacy is a place. And then we have 2 more pictures, capsules and tablets. Let's pronounce again, capsules. And then we have tablets. So take a few seconds to look at the pictures. And let's look at number 1, 2, 3, and 4. So number 1, it says, where can you buy medicine? Number 2, who can give you medicine there? Number 3, what can you take if you have a headache? And number 4, where can you find information about the medicine? So I'm going to have you either pause the video and think about these questions. As soon as you're ready, okay, play the video again. So for number 1, our answer is at a pharmacy. So where can we buy medicine? If we look at this picture, okay, we can buy it at a pharmacy. Number 2, our answer is a pharmacist. Who can give you medicine there? A pharmacist. Okay, number 3, a tablet or a capsule. What can you take if you have a headache? A tablet or a capsule. And we have those 2 pictures here. And lastly, our answer is on the medicine label. So where can you find information about the medicine? On the medicine label. So if you want to put pause, and then some of you might want to translate some of this information to your first language, you are more than welcome to do that. So put pause, take a moment, and then when you're ready, play the video again. So what I'm going to do now, okay, for those of you who are ready to move on, I'm going to vocabulary. So tonight's vocabulary activity is the following. Let's read the directions. It says, learn key vocabulary from this lesson. Read the sentences with the words in bold below. Match each sentence to the sentence that could follow it. So let me zoom in a little bit for those of you on your cell phone. We have the following information. Number 1 says, the medicine expires by January 2025. 2, always keep medicine out of reach of children. Number 3, some medicine causes dizziness. Number 4, some medicine comes with a refill. Number 5, Store the medicine in a dry place. Number 6, sometimes you need to consult with your doctor. So let's look at the words that are in bold. So the words in bold mean the words that are darker. Here, our word in bold, or our words, 2 words, expires by. Our words next and 2 are out of reach. The next one is causes dizziness. And I know for some of my students last night, okay, they had a difficult time pronouncing this word. So let's practice. It is dizziness. Okay, so if you want to pronounce again, dizziness. Our next word, refill. Our next word, store. And our next word, consult. So let's go ahead and go through our answers. We need to make sure that we match them to the right. So on the right, we have A, it makes you feel like you're falling. B, call or make an appointment to talk to him. C, keep it on a high shelf in a closet. D, don't leave it near the sink or shower. E, it's not safe to use it after that. F, when the bottle is empty, you can get more. So if you want to put pause here, reread the sentences, and then you make an attempt. Okay, so when I say make an attempt for my Spanish speakers, quiero que ustedes hagan el intento de poder contestar estas actividades, donde tienen que emparejar la primera parte con la segunda parte. So for this activity, you need to make sure that you pair the left side correctly with the right side. So let's look at number 1. So the medicine expires by January 2025. So let's look at our first answer. Our first answer is it's not safe to use it after that. Okay, let's look at our next answer. Always keep medicine out of reach of children. Our answer is C. Keep it on a high shelf in a closet. Let's look at number 3. Some medicine causes dizziness. 3 is A. It makes you feel like you're falling. Let's look at number 4. Some medicine comes with the refill. 4 is F. When the bottle is empty, you can get more. Let's look at number 5. 5 is store the medicine in a dry place. Number 5 is the letter D. Don't leave it near the sink or shower. And our last one is number 6. Sometimes you need to consult with your doctor. 6 is B. Call or make an appointment to talk to him. So hopefully you did a good job. If this didn't make sense, remember that you can ask me when we come back from vacation. So let's go ahead and go to our next activity, number 4. So number 4, now we have this picture to the left side. Okay, if you want to put pause, you can put pause. I'm going to read the information on the left side. So the first thing that we see is Harding Pharmacy. We have the name of the pharmacy. Okay, we also see the address, 200 Main Street, Naples, Florida. We also see the phone number, 239-555-0134. We see the prescription number, 0100002000. We have the name of the doctor, Dr. Ruth Baker. We have the date filled, 03/02/2023, or we can say March 2nd, 2023. We know the person who got this, Kevin Chang. I want you to remember he's a patient. He's the patient, the person who is getting the prescription. Okay, I'm going to give you a few seconds to read dosage. and to read warning. So if you want to put the video on pause, put the video on pause. And when you're ready to press play, press play. So for dosage, okay, it says take 1 capsule twice a day for high blood pressure. The warning says consult a doctor if you are taking another prescription medicine. May cause dizziness. Keep this and all medicine out of reach of children. Okay, the next piece of information we have is this, the name of the medicine. The medication is called Bonapin. Okay, it's 20 milligrams. We have 60 capsules. It expires on June 4th, 2025. And we have 2 refills. So if you need to look at the information again, put pause. When you're ready, put play, and we're going to answer the questions. So let's read what the information tells us. The information up here says prescription medicine. Prescription medicine is medicine that the doctor prescribes. Always read the label on your medicine before you take it. So our instructions are the following. Read the medicine label and answer the questions. Question 1, what is the name of the medicine? Question 2, who is Ruth Baker? And question 3, who is Kevin Chang? So let's go ahead and answer those questions quickly. Okay, I want you to again look at the label. Okay, identify this information. If you need to put pause, put pause. So number 1, what is the name of the medicine? And I'm going to go back to the document and highlight this. Okay, that is the name of the medicine, Bonapin. Okay, who is Ruth Baker? Let's look at her title, doctor. And who is Kevin Chang? Okay, he would be the patient. So let's go ahead and write our answers. So Bonapin is our medicine. Ruth Baker is the doctor, and Kevin Chang is a patient. He's the person who Ruth Baker prescribed the medication for. If you need to put pause, and then review the information again. We are going to be moving on to our next activity, number 5. So in activity number 5, we have the following. We're still looking at the same information that we did in activity number 4, but this time we're looking at dosage information. It says the dosage information on a prescription medicine label tells you how much medicine to take. It says cite evidence, read the dosage information. Are the sentences below true or false? Which phrases gave you your answer? So Kevin is taking Bonapin because he has high blood pressure. And 2, he needs to take 1 capsule a day. So I'm going to have you put pause and then tell me, is this true or is this false? And we'll check our answers in a minute. So if you're ready, okay, let's go ahead and check our answers. Remember, you could put pause anytime in the video so that you can make an attempt. So when I say attempt for my Spanish speakers, quiero que no esperen a que les dé la respuesta, sino que intenten, hagan el intento. In English, make an attempt. So let's look at our first answer. Our first answer is true, and it's right here, for high blood pressure. Our answer for number 2 is he needs to take 1 capsule, okay, a day. That's false. Take 1 capsule twice a day. So our information, okay, is located in the same place. Twice a day, and then the other one was for high blood pressure. If for any reason you need to put pause, and if any of these words you need to look at them, okay, in your first language, please, okay, put pause and look for these words. Okay. Recuerden que pueden hacer pausa en cualquier momento para el video. Okay. Y una cosa, si no entienden alguna palabra, que por favor, que búsquenla, que para que ustedes sepan que el significado o lo que quiere decir en su primer idioma. So let me go ahead and move on. If we're ready to move on, let's move on. Okay, we're going to do activity number 6. So activity number 6, we're still looking at the same information. However, now we're going to be looking at 3 different pictures. So it says warning. The warning on a medicine label tells you how to use a medicine safely. Read the warning on the medicine label, then look at the pictures. Which warning does each picture show? So let me go ahead and make this a little bit smaller so that we're able to see the entire information. So here we want to first go back to our warning label. And it says, consult a doctor if you are taking another prescription medicine. May cause dizziness. Keep this and all medicine out of reach of children. So with our first picture, okay, we have those same 3 sentences now in A, B, and C form. So if you're ready, okay, give me an answer or put pause, look at the picture, look at A, B, and C. And I'm only going to read A, B, and C once. A is consult a doctor if you are taking another prescription medicine. B, keep this and all medicine out of reach of children. And C, may cause dizziness. So if you're ready to answer, our answer should be C, may cause dizziness. Okay, I believe now we're ready for 2. The same concept, we have the same A, B, and C. Okay, now we have a different picture and we have to determine, is it going to be A, B, or C? So let's check our answer. If you're ready, let's check our answer. Our answer is B. Keep this and all medicine out of reach of children. Okay, we're going to do the last one. Okay. And I'm sorry, I put A already. I didn't give you a chance. So this picture is a doctor. It's a patient. Okay, our answer should have been consult a doctor if you are taking another prescription medicine. Remember, it's always important to let your doctor know what other medication you are taking. So let's go ahead and move on to the next activity. We are now going to activity number 7. So here we are just practicing looking for the abbreviations of the underlined words. So abbreviations, it tells us here, an abbreviation is a short form of a word. You will find abbreviations on medicine labels. So answer the questions and we're going to look for the abbreviations of the underlined word. Okay, so here we have the following words: capsules, milligrams, expire. So on this label, I want you to look for these abbreviations. So you may put pause and look for these abbreviations on your own. Those of you who are ready, we're going to go ahead and look at the answers. So the first one would be CAPS for capsules. If you're ready for number 2, okay, our answer for milligrams is mg. And then our abbreviation for the word expire is exp. So I'll go ahead and make sure to put them there so that you can see. Okay, CAPS, mg for milligrams, and exp for expire. So let's go ahead and check our first answer. So how many capsules are in the bottle? So our first answer is 60. Okay, you should have been able to locate that. Okay, number 2, how many milligrams does each capsule weigh? Let's check our answer if we're ready. 20. And number 3, by what date does the medicine expire? If we're ready to check our answer, let's go ahead and look at our answer. Okay, June 4th, 2025 is our expiration date. We're gonna go ahead and do one more activity for speaking. And we wanna go ahead and make sure that we listen to this. So here we're gonna see a customer or pharmacist, okay, having a conversation. So I'm gonna play it for you once, and then I want you to put pause and I want you to repeat.
Can I ask you a question about this medicine?
Sure, go ahead.
Does it have any side effects?
You may feel tired after you take it. This medicine causes drowsiness.
So I probably shouldn't drive after I take it.
That's right.
Can I take the medicine on an empty stomach?
No, you should take it with meals.
I see.
Anything else?
No, that's all. Thanks.
Okay, so my goal for this is that you repeat all of these words again. Okay, if there's words that you don't know, you can put pause. You can go ahead and look for these words in your first language. So let's go ahead and do this. Okay, and you can repeat after me. Customer, can I ask you a question about this medicine? Pharmacist, sure, go ahead. Customer, does it have any side effects? Pharmacist, you may feel tired after you take it. This medicine causes drowsiness. Customer, so I probably shouldn't drive after I take it. Pharmacist, that's right. Customer, can I take the medicine on an empty stomach? Pharmacist, no, you should take it with meals. Customer, I see. Pharmacist, anything else? Customer, no, that's all. Thanks. So if you need to repeat this more than once, you can put pause or you can rewind it and then listen again. Okay, we want to make sure that we pronounce the words correctly and that we get used to the sounds in English. So here we have read and listen to the conversation, complete the sentences, then practice the conversation in pairs. So here the medicine has it causes, you should not take it. So you had already seen the answers. Okay, so really quickly for this part, the medicine has a side effect. It causes drowsiness, and you should not take it on an empty stomach. So for our lesson for health, okay, we are done with the number 7, the part number 7, which is life skills. And really quickly, this part, okay, we're not going to go ahead and do this, okay, for now. Okay, I want to make sure that we practice. Okay, part of why we're in English class is because we're going to start learning how to write more. Our goal is that on May, okay, by the end of this school year, in May, you're able to write paragraphs in English. Okay, I know for some of you, when I said we're going to write a letter, a lot of you had anxiety that was all the way up here. I want you to feel comfortable, okay, and know, okay, what to write and how to express your thoughts in English. So what we're going to go ahead and do is really quickly look through this lesson. Okay, we're going to be, and it says in this lesson, you are going to write a description of a classmate's eating habits. You're going to write a topic sentence and then support the topic sentence with details. So really quickly, all I want to look at tonight is, okay, if I were to ask you, okay, choose a meal to describe, okay, what do you usually eat for breakfast? What do you eat for lunch? Or what do you eat for dinner? You should be able to give me information in English. For example, here we have, for lunch, I usually have a cheese or tuna sandwich. Sometimes I have potato chips with it. and sometimes I have an apple. I'm going to go ahead and tell you, okay, and I'm not going to write it. Okay, for breakfast, I usually have coffee, egg whites, and toast. For lunch, okay, I'm bad. I have bad eating habits. I don't have lunch because I'm working all the time. And then for dinner, it just depends. Okay, my husband, okay, or I will cook. It depends if it's chicken or if it's soup or if we buy food from a restaurant, like a pickup or takeout. So that would be, okay, a different conversation. So that would be number 2. For number 3, okay, we would analyze. So here we're looking at, okay, this picture and we're analyzing in groups. Okay, group A, okay, we're going to determine, how to answer these questions or how to write more information. Group B, we're going to go ahead and look, okay, at each sentence and then determine what else to write. So one of the most important things when we're writing in English is how do we write more information, okay, and add more details. And we want to make sure that we go from just being, okay, I like you, so I like you because, okay, you're kind, you're friendly, okay, you treat me well. Okay, we want to make sure that we're able to answer, okay, or not answer, but say more information. So that's really what I wanted you to think about. I know it's a lot, okay, and I'm sorry that I'm not with you tonight, but I really want you to make sure that you watch this. The last thing I want to make sure that you remember, and hopefully you're, okay, still watching the video, is the progress. And I'm going to make a separate video to talk about the progress. Remember that I have this information and I look at how much you're working on Burlington English. If you stop working on Burlington English, I'm going to ask you if you have time during the 2 weeks that we have vacation, please work on Burlington English. Okay, this is what the school's looking at. They're looking to see if you're completing your work. Make sure that you do that. So anyways, hopefully you enjoyed the lesson. I will see you on January 5th. And then there's going to be one more video, and the video is just going to be a quick announcement. So thank you all, and I will see you back, okay, in January. Okay, have a good Christmas.